Are you over 50 and waking up at night to urinate more often than you used to? Or maybe your urine stream has become weaker, slower, or harder to start. These may not just be normal signs of aging. They could be warning signals that your prostate is enlarging. Doctors say that more than half of men over 50 develop an enlarged prostate, a condition known as benign prostatic hyperplasia. In this video, we will reveal 7 warning signs of an enlarged prostate that many men ignore. But recognizing them early could protect your health and help you seek treatment before symptoms become severe. As men grow older, their bodies go through many natural changes. One of the most common yet least discussed changes happens in the prostate gland. The prostate is a small gland located just below the bladder and in front of the rectum. Its primary function is to produce fluid that nourishes and transports sperm. However, as men age, this gland often begins to enlarge. This condition is called benign prostatic hyperplasia, commonly abbreviated as BPH. The term benign means the growth is not cancerous, and hyperplasia refers to the increase in the number of cells within the prostate gland. Although it is not cancer, BPH can significantly affect a man's quality of life. The enlarged prostate presses against the urethra, the tube that carries urine from the bladder out of the body, which can lead to a range of urinary problems. Medical research shows that prostate enlargement becomes increasingly common with age, according to research published in JAMA by Dr. John T. Way and colleagues from the University of Michigan. Up to 40% of men over 50 experience lower urinary tract symptoms related to prostate or bladder conditions. For many men, the symptoms begin slowly and may seem harmless at first, but recognizing the early warning signs can help you seek medical advice before the condition worsens. In this video, we will explore 7 warning signs of an enlarged prostate every man over 50 should know. These signs are supported by medical research and clinical observations from urologists worldwide. Let's begin. Warning sign number 1. Frequent urination. One of the earliest and most common symptoms of an enlarged prostate is frequent urination. Men who experience this symptom may notice that they need to visit the bathroom far more often than they used to. This can occur during the day or even shortly after drinking small amounts of fluids. Why does this happen? When the prostate enlarges, it begins to press against the urethra and partially obstruct the flow of urine. This obstruction makes it difficult for the bladder to empty completely. As a result, the bladder fills up more quickly and signals the brain that it needs to be emptied more often. Clinical research consistently shows that urinary frequency is among the most prevalent symptoms associated with prostate enlargement. A large clinical analysis published in Urological Research found that urinary frequency, urgency, and weak stream are among the most common symptoms experienced by men with BPH. For many men, this symptom may appear gradually. At first, it might simply mean an extra bathroom trip during the day, but over time, it may become disruptive, affecting work, travel, and daily activities. If you notice that your urination frequency has significantly increased, especially without an obvious cause such as increased fluid intake, it may be an early sign of prostate enlargement. Warning sign number 2. Waking up at night to urinate. Another major warning sign of prostate enlargement is waking up multiple times during the night to urinate. This condition is known as nocturia. For many men, nocturia becomes one of the most frustrating symptoms because it disrupts sleep. Poor sleep can lead to fatigue, irritability, and decreased productivity during the day. Research studies show that nocturia is extremely common among men with prostate enlargement. A clinical investigation led by Dr. Koji Yoshimura and colleagues evaluated over 500 patients diagnosed with symptomatic BPH and found a strong relationship between prostate enlargement and nighttime urination. Another study analyzing lower urinary tract symptoms reported that nocturia is one of the most bothersome symptoms affecting quality of life in men with prostate enlargement. Furthermore, research published in BMJ Open by Dr. Emmanuel Chartier-Kassler and colleagues found that frequent nighttime urination significantly affects sleep quality and is associated with insomnia and excessive daytime sleepiness in men with prostate enlargement. If you regularly wake up 2 or more times every night to urinate, it could be a sign that your prostate is pressing against the bladder and interfering with normal urinary function. Warning sign. 3. Weak urine stream. A weak or slow urine stream is another classic symptom of an enlarged prostate. Normally, urine flows from the bladder through the urethra in a steady and relatively strong stream. However, when the prostate becomes enlarged, it squeezes the urethra and restricts urine flow. Men with this condition may notice that their urine stream is weaker than before. It takes longer to empty the bladder. The stream may start strong, but weaken quickly. Clinical studies have repeatedly confirmed that a weak urinary stream is one of the most common symptoms in men with BPH. Medical surveys and clinical research report that weak or interrupted urine flow is among the most frequently observed symptoms in patients with prostate enlargement. In fact, some studies show that doctors consider weak urinary stream one of the key indicators when diagnosing lower urinary tract symptoms associated with BPH. If you notice that your urine stream has become noticeably weaker over time, it may be a sign that the prostate gland is compressing the urethra. Warning sign number 4. Difficulty starting urination. Another warning sign many men overlook is difficulty starting urination. Some men describe this experience as standing at the toilet and waiting several seconds, or even longer, before urine begins to flow. This symptom occurs because the enlarged prostate obstructs the urethra and interferes with the bladder's ability to release urine smoothly. Doctors sometimes refer to this symptom as urinary hesitancy. Research shows that urinary hesitancy is commonly observed in men with prostate enlargement and is frequently included in clinical evaluations for lower urinary tract symptoms. When the bladder has to push harder to overcome the obstruction caused by the prostate, it can also lead to long-term complications such as bladder muscle strain. If this symptom becomes frequent or progressively worse, medical evaluation is recommended. Warning sign number 5. Feeling that the bladder is not completely empty. Another common symptom of an enlarged prostate is the persistent feeling that the bladder is not fully empty after urination. Even after finishing, a man may feel like he still needs to urinate again. This happens because the obstruction created by the enlarged prostate prevents the bladder from emptying completely. When urine remains in the bladder after urination, doctors call it post-void residual urine. Clinical research shows that incomplete bladder emptying is strongly associated with lower urinary tract symptoms and can significantly affect quality of life. Over time, this symptom can lead to additional complications such as urinary tract infections, bladder stones, and even kidney problems if left untreated. Recognizing this symptom early can help prevent more serious urinary complications. Warning sign number 6. Sudden urge to urinate. Another important warning sign of prostate enlargement is a sudden and intense urge to urinate. This condition is known as urinary urgency. Men with urinary urgency may suddenly feel a strong need to urinate and may struggle to reach the bathroom in time. This symptom occurs because the bladder becomes irritated and overactive due to the obstruction caused by the enlarged prostate. Medical studies show that urgency is one of the most common and bothersome symptoms associated with lower urinary tract disorders related to BPH. In some cases, urgency may even lead to accidental urine leakage, especially if the bladder contracts suddenly before reaching a restroom. Although urgency may seem like a minor inconvenience, it can significantly affect confidence, travel, and social activities. Warning sign number 7. Dribbling after urination. The final warning sign of prostate enlargement is dribbling after urination. This occurs when urine continues to leak slowly after a man believes he has finished urinating. Many men notice small drops of urine leaking into their underwear shortly after leaving the bathroom. This happens because the bladder does not empty completely and the urethra remains partially obstructed by the enlarged prostate. Over time, this symptom may become more noticeable and may lead to discomfort or embarrassment. Doctors classify this symptom as a post-micturition symptom, which is commonly observed in men with prostate enlargement. Recognizing this sign is important because it may indicate that urinary obstruction is becoming more significant. Why prostate enlargement happens. The exact cause of prostate enlargement is not fully understood, but scientists believe it is largely related to hormonal changes that occur as men age. As men grow older, the balance between testosterone and estrogen shifts, which may stimulate prostate cell growth. Genetics, obesity, and metabolic conditions may also play a role. Research has shown that prostate enlargement becomes increasingly common with age and is strongly associated with lifestyle and metabolic factors such as hypertension and obesity. Some studies estimate that around 40% of men in their 50s experience symptoms. The percentage increases significantly with age. This is why prostate health becomes increasingly important after age 50. When to see a doctor. Although prostate enlargement is common, it should never be ignored. Men should consider speaking with a healthcare professional if they experience frequent urination, difficulty urinating, pain or burning during urination, blood in urine, sudden inability to urinate. Doctors may perform several tests to evaluate prostate health, including medical history review, digital rectal examination, urine tests, prostate-specific antigen, PSA, blood test, ultrasound imaging. Early diagnosis can help manage symptoms effectively and prevent complications. Finally, prostate enlargement is a common condition that affects millions of men around the world. Although it is not, it can significantly impact daily life and long-term health if left untreated. Understanding the early warning signs can help men seek medical advice and manage symptoms before they become severe. To recap, the 7 warning signs of an enlarged prostate include frequent urination, waking up at night to urinate, weak urine stream, difficulty starting urination, feeling that the bladder is not empty, sudden urge to urinate, dribbling after urination. If you or someone you know experiences these symptoms, it is important to speak with a healthcare professional for proper evaluation. Taking care of prostate health is an essential part of maintaining overall health and quality of life as men age.